Have you ever landed somewhere totally foreign, where you didn't speak the language or understand the culture, or even recognize the food? When I learned that cold, snowy Wausau was welcoming new refugees, people who spoke foreign languages from climates totally different from the northern latitudes of Wisconsin, I knew I had to help. For me, starting over is nothing new. Let me back up. I'm Jonathan, a medical student at the Central Wisconsin campus of the Medical College of Wisconsin. Medicine wasn't my first career, though. It wasn't even my second. First, I was a teacher. A young college grad from the Midwest, I decided to join Peace Corps. I was sent to a small town in Burkina Faso in West Africa to teach math and science in a middle school. I could hardly speak French, let alone teach in it, and I knew nothing about the town. Where would I get food? How would I get around? Would I make friends? But almost as soon as I'd arrived, my neighbors came to my door. They welcomed me into their homes, showed me around town, helped me learn their language and culture, and became my close friends. I realized that most of the world is a welcoming place, full of people happy to help neighbors in need. I spent the next several years pursuing a career in public health and traveling when I could. I visited Europe, South and Central America, India, and Japan. I did graduate school work in Ebola response back in West Africa. I moved to Alaska and settled down to a job as an epidemiologist for several years. Soon, though, I got tired of my desk. I missed the joy of working directly with people. That, and another itch I'd had for clinical skills, led me back to Wisconsin for medical school. When I got to Wausau, I reached out to the Multicultural Community Center, our new refugee resettlement office, to see if I could lend my cultural and public health skills to the effort. For much of their work, the agency relies on co-sponsorship teams, local volunteer groups who pair up with refugee families for the first 9 months of their arrival. They asked me to make a guide that would help these teams navigate the healthcare system. Of course, I was new to Wausau too and didn't know quite how refugee healthcare would work here. So to find out firsthand, I joined one of the teams and took on healthcare coordination for a family from Afghanistan. In the process, I learned about their old lives, the family and friends that, in a flurried exodus, they had to leave behind. I felt worst for the kids who couldn't understand the situation, only freeze in the cold, stick out at school, and miss their old home. Quickly, though, they prevailed. They picked up English, the father found a job and learned to drive. And over the next several months, my team and I became close friends with the family. As I worked on the health guide, I met many of the incredible people and organizations working to welcome refugees to our community. Drafts of the guide were reviewed by local stakeholders, especially Bridge Community Health Clinic, which has been a crucial partner, providing the majority of primary care services for Wausau's refugee community. I also learned about the shortcomings of our healthcare system, the difficulty of using public transportation to get to and from appointments, the language barriers, the varied cultural expectations of medical care, and the shortage of providers. And I remembered that old lesson from before, that we rely on our friends and neighbors for help. As I begin my career as a physician, at a time when global displacement is at an all-time high, it's clear that the need for immigrant healthcare will only grow. I look forward to providing that care, and I'm thankful for everything I've learned from Wausau's refugees and the community that has embraced them.